All right, so for mosquito-borne diseases and climate change. I want to start out simple with how mosquitoes spread disease. First, a mosquito bites an infected human. So say the father's infected, the mosquito will bite the father. And then the mosquito has the disease, such as dengue, Zika, one of these diseases. And then the now infected mosquito will bite an uninfected human, say the mother, and that spreads the disease to them. So pretty simple to get us started. As far as climate change goes, the range of mosquitoes in the world is increasing. So as the world warms up, mosquitoes can migrate to places that were once too cold for them. So the initial areas where mosquitoes are in these darker red areas, mosquitoes are now spreading to these lighter orange areas throughout the globe. So they're definitely increasing the range in which they live, and that can increase how many people are infected to or exposed to infected mosquitoes. And then furthermore, global warming allows mosquitoes to live longer into the year, they can reproduce more frequently, and they bite humans more, and all of this together can increase the disease spread. And then just for fun, this is a map that NASA shows of mosquito range in the United States. So as you can see, pretty much covering the entire United States and some of Canada as well, which has definitely been increasing in the past few years. With this, as I mentioned, leads to increased incidence of disease, so incidence being new cases that are reported of different diseases. So new cases of dengue, which has symptoms on the right, eye pain, muscle pain, joint and bone pain, as well as fevers, headache, nausea, vomiting, and rash, have increased 30 times globally over the past 50 years. This disease can also cause longer-term complications like infection of the brain or infection of the heart muscle. New cases of chikungunya, which is another disease that can cause fever, rash, and then months to years even of joint pain, have also increased and are now at estimated 35 million cases throughout the world in the past year. And then finally, new cases of Zika, which is a disease that started becoming more prevalent in 2015 in South America and causes birth defects in newborns, has increased since 2015. So I just wanted to mention some emerging diseases related to climate change. As the planet warms up, these diseases are becoming more prevalent. And as you can see, it's a whole list of diseases that have occurred all the way from 2003 up until 2023. I wanted to highlight the ones with these black arrows. So Zika here in 2015, dengue in 2010, yellow fever in 2016, and plasmodium, which leads to malaria in 2011. These are all diseases that are related to mosquito spread. And yeah, these are diseases related to mosquito spread and are just some of many, many diseases that are emerging as climate change progresses. So that's a lot of doom and gloom, but what can we do about it? So measures to prevent or limit these transmission effects, we can create vaccines for different viruses. A dengue vaccine is in the works, and a chikungunya vaccine is actually created. We just need to distribute it to people. Working on hygiene and sanitation so there are less areas for mosquitoes to multiply. And then we're doing here making sure that people are aware of these diseases and how climate change is impacting them. In addition to this, efforts to eliminate breeding sites and manage solid waste, as I mentioned with sanitation, can help limit the amount of mosquitoes. Mosquito repellent use is a big thing for keeping yourself safe, for personal protection against these diseases. And then scientists are also researching genetic modification of mosquitoes, which prevents them from breeding, as well as smarter traps to eliminate mosquitoes.